third Thursday of November. That's coming up. Smokers across the nation take part in the American Cancer Society's Great American Smokeout event. And this is the time when you say to somebody that you know that smokes, encourage them to use that date to make a plan to stop, quit, whatever in advance and make it that day. You know, quit that day. Even for one day, it's a big, big step. So joining us now, he's in our virtual green room, Scott Ballin. He's a health policy consultant. I mentioned this already, based in D.C. And here's the key. He spent more than 40 years involved in issues related to tobacco and public health. Scott, thanks for coming on. We appreciate it.
It's my pleasure, Kate.
Do you feel I was looking at the numbers, and do you feel that it's encouraging, according to the CDC, that the U.S. smoking rate has dropped down to 15.1%, and that's from 2015? Do you feel encouraged by that?
Absolutely. There's no question about that. I mean, when you look back many decades and look where the number of people who were smoking was well over 50% of the adult population. So we're making tremendous progress, but we got a long way to go. In terms of numbers, there are still 35 million adult smokers out there, and they are dying every single year. The smoking remains the number one preventable cause of death in this country. 480,000 people die each year because of smoking, and so we can do a better job. We need to keep our efforts going. We've got taxes that discourage people from purchasing cigarettes. We've got clean indoor air laws that don't let you smoke in public places or even in parks anymore. So we're making progress, but there are some other options and strategies I'd like to talk about on tonight's show.
Yeah, so some of the alternatives, right, are non-combustible forms of tobacco and e-cigarettes. Then haven't they helped in dropping the smoking rate?
Yeah, they're beginning to help. And earlier this year, the Commissioner of the Food and Drug Administration, Dr. Scott Gottlieb, said that the FDA is going to take on some new initiatives to add to its already, multiple arsenal to take on the cigarette smoking issue. One will be to try to reduce the levels of nicotine in cigarettes. So that will mean reducing the addiction, but there must be, as part of that, alternative products that could be available to smokers, and these are the non-combustible products. I have to remind people that it's not the tobacco that kills you, it's what you do with it. When you light it on fire, the smoke goes into your lung, and that causes the cancer, the heart disease, and the stroke. Now, there are new products out there, and there have been some on the market for a long time that are non-combustible, and you can get a cleaner form of nicotine that will reduce your risks of those diseases. And that's where the FDA wants to be headed, with allowing these products on the market and encouraging people to look at that as another option for reducing their smoking risks. And, this is all going to take some time, but a lot of people, including myself, after having been in this for 40 years, are very excited about this option. It includes e-cigarettes that I think many people have heard about, but it also includes other smokeless tobacco products such as Swedish snus, and also some newer products. One that's it's a heat not burn product. It's tobacco, but it heats the tobacco, doesn't burn it. And that's at the moment going to be considered by the FDA starting in January for making that product available to the public, hopefully sometime next year. So there's a lot of exciting things going on out there. A lot of us who have been in this business for a long time want to see smoking end. We think that's the major cause, and we can do more to step up our efforts. The Great American Smokeout is one way to do that, but these new strategies that the FDA is looking at are even better.
Yeah, and so sadly, in some states, while we're seeing there's having this great effect with, smokeless tobacco, e-cigarettes, all that kind of stuff, like California and Minnesota, they have these new laws that are kicking in that ban retail sales of flavored tobacco products, whether combustible or not. But I know this has worked for people I know. Why are flavors so important for smokers trying to switch to the alternatives?
Their flavors are not allowed in cigarettes, and I think that's a major step forward. But they should be allowed in these alternatives. They shouldn't be in flavors or marketed that may entice young people to take up the habit or try these products. There are many things that we as adults use that are flavored and they're marketed appropriately, pharmaceutical products, et cetera, foods. And this has to be worked out and worked through. But a blanket ban of flavors, I don't think is the right approach. And FDA has said that they want to sit down and have a open dialogue sometime next year to work through these issues on flavors. In order, a person, an adult who wants to use these alternative products isn't going to use them if they taste terrible. So you've got to make these consumer acceptable products, but you also want to keep them out of the hands of children and adolescents. And personally, having been in this business a long time, I think that can be done if all the various stakeholders sit down at the table and work through some of this stuff. I know a lot of these state houses and local city councils are, sort of jumping on the bandwagon to ban the flavors, but I think they need to take a step back and look at the pros and cons of it and see this dual approach of giving adult users the option for buying these products while keeping it out of the hands of kids.
Yeah, what among the 40 years is a long time to be in the business. You obviously know a lot of people, have a lot of conversations. What do your counterparts say? What are they worried about?
Well, it's interesting that the tobacco industry, my counterparts are really the tobacco industries, and they've changed dramatically. They are the ones that accepted FDA oversight. They are the ones that are now investing hundreds and hundreds of millions of dollars into developing these newer science-based products that are going to have to be approved by the FDA. So there's a potential change in the air. It's a very different environment than when I first worked in this area, when the industry fought tooth and nail against practically everything we tried to do. Probably your older audience may remember the 7 CEOs of the tobacco industry standing up before Congress swearing that nicotine was not addictive. Now everybody accepts that, the industry accepts it, and I think this is an opportunity for some real progress to make some changes. I wouldn't say we should trust the industry 100%. I would never say that, but I think that now that we have an agency such as the FDA providing oversight to them, we have some opportunities to make sure what we do has a benefit to public health.
Yeah, and I started this talking about the fact that we have, and you've seen this now for a long time, the Great American Smokeout, and at least that's a step in the right direction, right?
Oh, absolutely. I think it's a reminder. People have, in many respects, after the FDA got jurisdiction, and even when there was a big settlement between the industry and a lot of lawyers back in the late 90s, people have become complacent about cigarette smoking. They think the problem has been solved and it's going to go away. Now, that may be true in some places like New York City and other places where the laws are much more stringent, but in many, many states, particularly in the states in the South, the smoking rates are exceptionally high, and you've also got a lot of people who are very poor smoking cigarettes because they're addicted. I have to remind people that we spend $300 billion a year in healthcare costs and lost productivity. We shouldn't be spending that. As taxpayers, we're paying for it. So we have to do more to help those people in those areas and places where they're still smoking, where they're addicted, and they don't have the means to quit. The Great American Smokeout has been a tremendous initiative all these years, and I've watched it and been a part of it. But I think that the environment is changing. We have some new opportunities to take advantage of, that we can actually rid this country of combustible cigarettes, hopefully in the next 10 to 15 years.
Yeah, I agree. Scott, thanks so much for coming on. We'll have you on again.
It's my pleasure. Thank you, Kate.
Yeah, good information. Talking about what is an interesting day and where we are as far as the U.S. smoking rate and what are we seeing with these alternatives, as he was talking about the non-combustible forms of tobacco in the e-cigarettes, and actually what so many people say, how it's helped them quit smoking cigarettes, and initially that was one of the reasons why many of these companies were formed, because of trying to kill off that habit. So the FDA, the conversation with the FDA, and what's happening in these various really states and how they're deciding on what they're doing moving forward has been really a fascinating process to watch. All right, hang with us, everybody. Much more coming your way on the flip side here on ATN.